Hello, my name is Hope Frost, and on behalf of SBK Healthcare, I'm delighted to welcome you to this Building Psychological Resilience Skills for NHS Professionals video. I do hope that you enjoy it and find it useful. Please do share your thoughts in the comments and make sure that you subscribe so that you don't miss any new content that we upload. Good afternoon, everyone. My name is Hope Frost and I'm from SBK Healthcare. I'm delighted to welcome you to this webinar on building psychological resilience skills for NHS professionals. I do hope that you enjoy the session today and find it useful. It is now my pleasure to introduce your webinar leader, Cathe Gaskell, who is a Managing Director of the Results Company. Hi, Cathe.
Hi, Hope.
Hello.
Pleased to be here. Okay.
Perfect.
Okay. Hi, everyone. Well, my name's Cathe, and I'm really excited to be here. I'm excited for a number of reasons. One, I want to hear your ideas about psychological resilience. So I'm a nurse. I've been in the NHS for about 30 years and sometimes in the private sector, and never more have I needed to have strong psychological resilience skills. I've trained in psychological resilience skills in the last couple of years at London Ambulance, so I've done quite a lot of work there. But boy, when COVID hit, pandemic hit, I really needed to refresh myself, use the skills myself, really think about my mental health. So today I want to share with you what I've learned, but also evidence-based practices to help you. So we haven't got a long time, but I want to give you some really practical tips. But I'm also really keen, two things. One, to hear from you, but also keep in touch. Let me know if they work. This is something we've all got to hang together and get right, psychological resilience. So I'm really keen to hear from you if the things have worked after our session. So I'm going to take us straight through. Oops, here we go. So learning outcomes, I really want you to take away some tips and tools, but even a bit more than that. So I want to talk about psychological resilience, give you a simple overview. What is it? What is this word that we're hearing about now? And why are we expected to have it? I was never trained in it when I was a nurse. I want to think about COVID and the effect on our mental health. Talk to you about positive psychology, optimism, which I find is really helping me. Then I'm going to give you the tips on resilience. And then I want to talk to you about a resilience plan, because I'm going to tell you this. Resilience isn't just for now, it's ongoing. It's something I'm going to have to practice, I think, for the rest of my life. So I really want to share those ideas with you. So let's start. So I'm going to tell you a little bit about resilience. You will have heard of it. Where did it come from? Well, this is something that's been around since the 60s, and it was sort of talked around when we thought about looked after children. And we thought about people's ability to cope. Are some people born with resilience? Some of us are. Can we develop it? Definitely. So it's been seen as it's been sometimes described as the bounce back ability. So if we go through an adverse event or a tragedy or a serious event, or even things at work, it could even be something like bullying and harassment. Can we bounce back afterwards to how we functioned before the incident? Now, resilience has been really important in dealing with COVID, but I'm changing the word from bounce back to navigate, because I'm not sure we will bounce back. I'm not sure we will be the same. So I think we need to think differently about resilience, think about skills, and think about navigating our way through this pandemic. And the good news is resilience can be learned. Okay. So COVID's impact on resilience. I think in the NHS, we know more than anyone the impact it's had on our patients, our families, ourselves. But really, I put all those impacts up there. The one I'm going to be talking to you about today is that ongoing uncertainty. And that's really difficult for us as staff, not knowing what's going to happen, because nobody does. So I was reading today that the first wave of sort of anxiety about the pandemic was really about lockdown and was about our own wellness. Were we going to get ill? Were our families going to get unwell? That wave has finished, and what's coming through is worries about financial issues, worries about people losing jobs, worries about bereavement, but uncertainty. Uncertainty is the big issue that's plaguing people, because we don't have any control over the pandemic. The only thing we have control over is our thoughts, our behaviours and our actions. And that's difficult. So that might be a cause of why there is so much stress at the moment in society, but particularly in the NHS. So I just wanted to put this up because we're living through a pandemic. It's a massive change, but we're also living through a historical revolution. 2020 is the year of Black Lives Matter, so big influence on diversity, big recognition of wider societal issues. So don't beat yourself up if your mental health isn't the best. Now, I find that cognitively, I take longer to make decisions, and that I'm slower at doing things. And I find that everyone is saying that generalized anxiety that hangs over us does slow down cognitions. And sometimes this is difficult at work. I don't multitask like I used to, and I'm aware that there is a pandemic effect. So please be kind to yourself. That's one of the tips about resilience, self-compassion. 2020 is a completely different year. Please be kind to yourself. So I put this one up, and lovely, healthy, gorgeous young woman on the side. What skills do we need as staff for resilience growth? I think we need skills we don't have. So as a nurse, I'm used to caregiving. So that's in my DNA. I like to give care. I like to make sure people are well. I'm not very good at care seeking. And I bet you aren't either. We are so indoctrinated into caring for people and being part of this big service that takes care of people. It's been a huge shift to recognize that self-care is what's going to get us through. So I put 3 things up here that I would love to have known when I was a young nurse. I need to be able to ask for help. Really important as somebody who likes to be in control, who's a caregiver, you need to be able to ask for help. You need to recognize when you're overwhelmed. So when we've stressed and maybe we're snapping or in conflict, we feel triggered by our colleagues or our family, recognizing when you're overwhelmed. And then lastly, focusing on self-care, focusing on sleep, diet, and exercise. And you know what? That just wasn't in my DNA because I'm a caregiver. I really had to rethink my life, how I am. And I bet some of you can identify this as well. If you've been in the NHS a long time, you're a problem solver, and you're used to fixing other people. Resilience is about us being in charge of ourselves, making sure that our healthcare is maximised for our physical health. So big change in mindset there. Mental health, I put this up. So mental health, I've got a mental health background. Mental health, keeping my mental health the best it can be, it's got to be intentional. So I'm saying to you all, you've got to think about your mental health. Doesn't matter where you are in the NHS. You could be a surgeon, a radiographer, an OT, healthcare worker, a porter. You have to think about your mental health intentionally. And a bit like fitness, physical fitness. So people take a pride in going to the gym, staying really healthy, looking good, weight and diet. We've got to do the same type of behaviour for our mental health. We have to think about what makes us stressed. We need to think about good boundaries. That's really important at work. We need to think about social media. Social media, evidence around social media is that actually can decrease our happiness and our optimism. A really good practice is to turn your phone off at 8 o'clock. Don't check your phone after 8 o'clock. Big tip to helping you stay optimistic. Don't watch the news too much. There are definite links to people who are looking at the news all the time and lowness in mood. So I'm giving you now some evidence-based ways to think about mental health, but it needs to be intentional. So again, we've got to think differently as caregivers. We've got to think about our physical health, our mental health, and actually make a plan. So where did this evidence come from? Have I just made it up? Has it just come from my thoughts? I've done a lot of reading around resilience and thinking, what do we have to do differently to get through this pandemic in an optimal, healthy way? And really, a lot of the evidence is coming from positive psychology. So today, we've only got a short time together. I hope is the first step for you starting to think about positive psychology, because it is an evidence-based science that's tested, that's proven, that does give tools to help us. So I put some of the researchers and psychologists that I've used to write the session for you. Martin Seligman, Laurie Santos, Karen Rivich, Brené Brown, and they are the people that I'm referencing for the rest of the session. So the information I'm giving you is evidence-based, but please take away that this is day one, first step. If you want to know about resilience, get reading, get looking what these people are saying, because they are really coming out with some great stuff around how we get through this pandemic, and it's around positive thinking, optimism, actions and behaviors, and we can only control ourselves. We can't predict. We've all got our fingers crossed, haven't we, for vaccine, but we can't predict as yet. Everything's going to just go back to normal. So the only thing we can control is ourselves, our thoughts. So I'm really urging you, have a think, have a look at what these people have written, look at their evidence base, because it's proving really helpful to healthcare staff on the front line as well. Okay, so the first tip should be keep hydrated, but I'm going to take you on to the next one. Okay, so the first tip here is hunt for the good in a work day. Isn't that simple? But do you know what? Aren't we a critical bunch in the NHS? We are. We often criticise ourselves, our colleagues. It isn't easy. I don't find it easy to take compliments. I don't know about you. It's easier to see what we haven't done than what we have. Now, this is part of a cognitive strategy called rewiring. And it's about your thinking. So you will have all heard that example. If I said to you, don't think of a pink elephant, you would all think of a pink elephant. Or don't look at red in the room, you'd all see it. We are wired to look at threat. So this is rewiring with exercises that I do every day now to look at positives. So hunt for the good in a work day. What went well today? What went well? What did I enjoy? What did I do? What went well? And it's a real discipline to actually rewire your brain. What went well? Now, we have a bit of help in this, because last year, some of you will have seen this going home checklist came out, and it came out, I think NHS Improvement put it out, and it was based on work with some safeguarding teams. I encourage everybody to have that on the back of the door, to have it in the office, because it's such a great reminder to acknowledge what went well, check on your colleagues, go home and switch off. So this is actually based on good cognitive evidence that we need to think about what went well, because it rewires us into seeing positives. Because, oh gosh, we can get into contagion of saying what's gone wrong. And all of you will have been in a team or met someone who likes to talk about what's gone wrong. And doesn't that affect the whole mood? Well, in this pandemic, I'm totally into thinking about what's gone right and learning and reframing. So we're going to talk about that next. Reframing, which I mentioned. So this is a tool that we can use every day, and I use it every day, and I train and I talk to staff about reframe a difficult situation. So rather than blaming ourselves, isn't that bad, isn't it terrible, turn it into a growth opportunity, and you could almost reframe the most difficult situation. So I'm going to give you some examples here. So reframing, we're not in denial. We're not saying it didn't happen. What we are saying is, what can we learn from this? How can we make this a learning experience? So have a look at this one. So a reframe would be: a relative made a complaint on the ward. This is something everybody worries about, complaints. Nobody likes complaints. But the way we approach it is that the care is not good enough. I've let people down. The reframe is, what went well that I could build on. I'm trying to build this into thinking with a complaints team, PALS teams across the UK. I'm talking to them about, let's turn complaints around. I know we say that it's a learning experience, but let's think about things that have gone wrong and turning it around. One that I often get asked about: somebody didn't accept a position in your team. Somebody didn't take that role that you'd interviewed and you'd spent a lot of time on. Actually, your competitors weren't better than you. This person wasn't right for your team. So reframe that. Do you know what? That person wasn't right for our team. They might have left quite soon afterwards. Let's look for the best person. Let's look for the right person for our team. Reframing is a really good tool to have to stop us spiraling down into ain't it bad at work. Okay. One of the things that I get asked about the most is how to manage catastrophic thoughts. And you know, I think we all suffer from them when you wake up at 2 a.m. and you've got that thought going around and around in your head. And for this, I really looked at the work of a lady called Dr. Karen Rivich, and she works with emergency responders, and she found this cognitive technique that really stops the brain. Now, there's a gender bias on this. So when we have a catastrophic thought, women ruminate, so we go over and over the thought, men spiral down. And it gets to the point where people feel terrible. So catastrophic thoughts about work, you have to do 3 things. And this is a really good discipline because you can't worry and act at the same time. So you think, how likely is this to happen? Okay, how likely is this to happen? Can I reframe it? And can I make a plan for it? Now, Dr. Karen Rivich has tested this time and time again and said it's the best way to stop us being up all night worrying about something, because worrying will not change the process. And I'm going to give you an example, one that comes to me quite often. So this is a catastrophic thought. So often staff will call me and worry about bullying and harassment, feel that they may have been dismissive or bullying at work. So I've got that up for you to read, but the story is you've been critical to a work colleague, you've done it in public, you realise it was wrong, but when the thought gets away, what if there's a complaint? What if CQC gets involved? What if I lose my job? We all have those tumbling thoughts that we can't be consoled. So this is what I tell people to do. You get your reality check. How likely is it the person will complain? You've known this person. You reframe it. You can learn from this experience. Make a plan. That is the best way to stop your catastrophic thought and build your resilience. And this is one that's a really honest plan. Seek out your colleague and speak face to face. So I know that's difficult if you can't speak face to face. So this is the rule of thumb if you want to resolve conflict. Teams first. So I know many of you turned your Teams cameras off. When you're at work, please, if you want to build rapport, Teams, have your cameras on. Secondly, you can phone a colleague. Thirdly, you can message a colleague. And fourthly, an email. Don't email an apology because it doesn't land. I have to feel it. So make a plan. So in this case, your catastrophic thought is my colleague might make a complaint about me. Look at the things you can do. You make a heartfelt apology. You book yourself on a communications course. You think about, do I need to take this to supervision? That's how you grab hold of that catastrophic thought that could paralyze you. You might not want to go into work and deal with it. So that's a really strong evidence-based resilience tip that I hope you take away and you find useful. Next one is social connections. It can be hard because we are in lockdown and so we can't see people, but social connections are a really good protective factor. Now, I know sometimes when I'm busy, I don't reach out to friends, and actually I make myself now, part of my resilience plan is to reach out to people on email, on Skype, because we're humans, we need face-to-face contact. We're like plants. We need the sunlight of human connection. So it's so important that we have that social connection. So when you get home from work and you just collapse and you don't speak to anybody in a week, your resilience will come down. So social connections in and out of work are really important. But I've got two caveats there to think about. So we all have what's called a silver lining friend. And that's the friend where you say to, oh, I'm really stressed at work. It's really difficult. And they say, at least you've got a job. You say, I'm really worried about my resilience. Well, what about other people? They haven't got anyone to talk to. So that person, this is a Brené Brown phrase. She talks about silver lining something. We might do this. Do you know what? We do this all the time in the NHS. Somebody says to us, oh, I'm really fed up about that. I'm really worried about that. Because we're problem solvers, we say, what are you talking about? You've done really well. You've got a great job. That person's not the same grade as you. Silver lining it doesn't help. It's shaming and blaming. It makes me feel like you didn't hear me. So if you want to talk to a friend, you need them to listen. You do the same. And the other friend is, and we all have one of these, ain't it bad, ain't it awful. In a period of growing your resilience, you need to keep away from people who want to talk about how bad it is, because it doesn't move us any further on. Now, we all sometimes work with those people. I certainly have, and they're not even aware they're doing it. But they will come in and tell you from the beginning of the shift to the end of the shift, ain't it bad? Now, that is not helping. So it's really important that we understand emotion is contagious. So optimism is contagious, as is moaning. So again, reducing time with people who moan and groan, reducing time with people, wonderful as they are, who put a silver lining on everything. Connections are great, but you need to be able to speak the truth and say, I'm fed up, and this is what I'm going to do about it. Okay. Gratitude. Oh, practicing gratitude in your team. Now, it doesn't mean just necessarily if you're a nurse in your nursing team. What about people across the trust who help you? What about porters, radiographers, OTs? What about people in the canteen? What about other people? Gratitude has a double bounce, because when you thank people, you also get a lift of serotonin. So again, this is a Laurie Santos tip. She said gratitude is really, really helpful in boosting your mood. And think about it. How often do we take time to write someone a card or send someone a note or thank them? It's really good for your resilience to thank people who help you, to thank people who make your life easier. And I think it's something we could all do more. It's such a nice thing to receive that genuine, heartfelt, not just, oh yeah, thanks for helping out on this shift. Genuine, heartfelt thanks for doing something. It's very important. So remember, it helps you as the thanker. You get a double boost. Your serotonin goes up. But two, you also feel really good. The person who gets the thanks really likes it as well. So it's a great boost. So think about that. And savoring. Savoring is a really interesting one. And this is one again from Laurie Santos. She talks about the pleasure of a good memory helping rewire our thinking. So it could be just something as simple as, and I put some pictures up, what was a really great memory? For a lot of people, it was a holiday. What about pets? What about family? Thinking about something lovely. We talked about rewiring to see positives. So savoring is something that you can do at work. You take maybe 25 seconds out and you think about something positive. Now, some people are doing this. They're tying it into an activity. They're tying it into hand washing. So they say, every time I hand wash, that's my time, because I've got to stand there and I savor. And it could be as simple as that really good cup of coffee on the way to work, or that really good walk into work. Savoring is really good for the brain, because we're thinking about pleasant memories, which could be a crazy ward, busy day, bad clinic, but whilst you're washing your hands, think about something positive and that feeling of calm. But also, another hit, a bit like gratitude, tell someone, I was just thinking about my holiday. I really, really enjoyed my last holiday. We had a fantastic time. You get a double boost as well. So savoring is something that we can all do. You can do it at work. It's a simple thing. If you tie it in with something you have to do, like hand washing, that's brilliant, because it means you might have to do it lots of times a day. And it is a proven mood lifter. This is an evidence-based, just a quick technique you can do at work. Okay, I want to take you on to something that I've just been learning about. Now, some of you might already be into mindfulness. Some of you might practice it. I've been learning a little bit about metameditation, because again, I've been reading about how helpful it is to healthcare workers. So if any of you who haven't heard of it, it is when you make a statement, and this is the one that's been written out, and it's such a lovely thing. So you say it to yourself, you say it and you think about someone you love, you say it for a neutral person, and then you can even say it for someone you're having difficulties with. So this is a meta meditation, and people might take 2 or 3 minutes and they just sit there and focus on the words. And I think the words are lovely. What I'm interested in is how that's going to be measured now, and see how it helps healthcare staff. So the initial evidence is that meta meditation, so saying positive phrases to yourself during a day, increase optimism. And we know from all the evidence from positive psychology that increased optimism, optimistic people have better physical health, have better mental health, have better relationships. So it's optimism is a real key to resilience. How can I build optimism? How can I build resilience? And metameditation is something that's new. Well, it's probably not new, but it's now been linked to resilience during COVID. So there's a piece of research going on. And if you just read the words, they're so lovely. It's such a nice thing to have a break, and you could have this and think, right, may I be healthy? May I be happy? May I skillfully ride the waves of my life? May I know peace no matter what life circumstances? So I thought about that before I did the session with you, because I thought I'm going to send that out to everybody. This is such a positive message, because we're rewiring to see the good in what is a very difficult time. We're not pretending it's not a difficult time, but keeping my brain optimistic, positive is going to make me better at work. It's going to make me a better colleague. So I just want you to think about that. These are just some things to consider. What simple things could I do in my work day to bring myself that peace, that optimism that will help build my resilience? Okay, so apps are there to help us. So NHS England or NHS Improvement has actually bought a number of apps that are free for NHS staff to use. So I put some of them down. And you know what? Why not use them? We've got resources now we didn't have before. There are a number of apps that are really helpful for people getting to sleep, whether it's music, calming. I know that sleeplessness is a big issue for staff. People often call me and say, I'm just not sleeping, I'm so worried. So we try the catastrophic thought, and then also try apps. Why not? Why not listen to some music, calm thoughts, stop the racing thoughts, stop the anxiety. Now, one of the apps I do want to recommend is one called Liberate. So it is particularly it's for anybody, but it's by BAME therapists. So it's by Black and Indigenous people. It's an American app, but the NHS bought it. And it's so nice. It has metameditations. It has all sorts of things on it that help calm us, that help us feel better. So it's a very positive app. Now, you can download these, check. As far as I know, I'm not paying for any of these. I think that people have given them for free, I think, till the end of the year. So I think it's a great time to think, as well as doing your resilience exercises, as well as thinking about your mental health, this is going to be better for you than Instagram. Trust me, this is going to be better. It's not a comparison. It's self-care. It's taking care of myself. It's thinking about myself. And I would love people to think about how you can weave this into work. Wouldn't this be great in a work session to have some positive, uplifting, helpful thoughts? So please have a look at those apps. So we're coming to the end of me talking, and I'm really interested in hearing your thoughts, your ideas. Really, I want to tell you about having a resilience plan. Because when you get stuck, when you have that bad day, when you have that very difficult patient, when you have that colleague who you find is being really in conflict with you, it's hard to calm ourselves. So what I'm finding is that build your resilience plan now for when the difficult times come, when the shift is there and you haven't got enough staff on, when people are arguing, when things are difficult. You've got your resilience in hand. You might have thought about your 3 good things. You might have made sure you've got a social connection. You might have sent some gratitude messages out. It really helps. And psychologists tell us it can be very hard to build resilience in the middle of a crisis. So I've been saying to everyone, use this time to build your resilience. This is a habit for life. This is a habit now for life. We need to be thinking about positive things and our mental health for life. Once the pandemic is over, we won't stop. I want this to come into induction. I want everybody to start thinking, I need to take care of my mental health and do positive things now so that I won't become very depressed and low and feel very desperate. So what psychologists are telling us is think about a resilience plan. So I have on my phone a list of my resilience actions that week, whether it's speak to my girlfriends, I sent a card out last night, whether it's find some memes that people might enjoy, whether it's send helpful messages, and also keep learning myself. So I really want to take away for NHS staff, self-care is not a luxury for you. You deserve it. And be intentional about taking care of your mental health. Because you know what, sometimes in the NHS we don't do it. We don't do it for staff. We've got to do it for ourselves. We've got to do it for ourselves and see this as a journey that you are investing in yourself. You go to the gym, you get a gym membership. Okay, this is now thinking about physical health, mental health. I'm going to have parity between the two. Okay, I've put some additional resources up there, so I hope that this is the first step in a journey. I've speeded you through because I want to spend some time talking to you. There is lots of stuff out there now on resilience. There are lots of little things that will make a big difference. So I've put some messages up there, some things that are in the pack that would be great if you wanted to read them, find out more. Let's start talking about this. Let's bring this to the fore. But also, this is the first step, if you haven't started thinking about resilience today, on how you can build resilience into your day-to-day life. It's not an add-on, it's part of my life now. Part of my life now is to check my contacts. Part of my life now is to do gratitude. I have to do this. It keeps me balanced. And that's it. I'm now looking forward to hearing your questions and talking to you all.
Thank you, Cathe. That was amazing. I've learned some things that I'm definitely going to put into place. So I really appreciate that. We've got a few questions coming through. Just a really quick one about the apps. Someone's asked if they are free for NHS Scotland as well. Do you know?
I know that they were bought by the NHS Improvement. So do you know what you can do is when you go on and download them, they'll ask you for your NHS trust. So it's worth checking. I would try them all. I'd take anything that's free. Try them all, but try them before Christmas because I believe they're only free to get by December.
Okay, yeah. Brilliant. And then someone else asked, do you need an account for them to use the app?
No, I just put them on my phone. So some trusts are saying you can have them on your work phone because they've been bought for us by as I said, NHS Improvements bought them. I just put them on my work phone. And so it's worth checking, but I have them on my own phone. So I'm not paying any money for them. They're all free. Now, some of them, if you want extra, I think Slumber, if you want extra stuff, you have to pay. I take all the free stuff that helps me get to sleep. So I'm not wanting staff to spend any money on this. This is bought for us. It should be our right to use it.
Okay, that's brilliant. Thank you. So someone, if I could ask you all, if you've got questions, if you write them in the Q&A box, and that way I can work my way through them and I won't miss anything, as it's hard to keep up with in the chat box. So the first question is, I'm finding it hard to switch off from work when working from home, as there is no physical divide or going home process. Do you have any tips?
Oh, yes. Well, I work remotely, so I definitely get that. So a couple of things I say to people: have your space. And guess what? I've had to change my space. It can't be the dining table, because every time I'm at the dining table, I think about work. So one of the biggest tips for you to switch off is you find your space. It's where you go for work, and you pack up at the end of the day. So you're taking the visual cues away. Do not work in your bedroom. Do not work on the dining table, because they will be reminders of work. You need a work-life separation. Next, stop checking your phone. We so do this because we're conscientious. You've got to switch off. The other thing is bring in virtual commutes. So stop having Zoom meetings back to back. It's killing us. Don't Zoom so much. Zoom meetings should be no more than 50 minutes. And if we're at work, we'd walk to another place to get people. So have a virtual commute. So when you do a Zoom, stop, get a drink, walk around, because sitting is the new smoking. It's bad for you. And make it separate, make it as close to work as you can. But the biggest tip I've got is find your space. So I'm up, got a little attic upstairs. This is my space now. So I know when I'm up here, I'm working. I've had to be, my boundaries help my mental health. So I don't work on the kitchen table. I don't work in the bedroom. I work where I can leave my stuff. And I stopped checking my emails. That's a big thing. And guess what? Don't check them on the weekend. Unless you're on call, turn your phone off.
Okay, that's a brilliant tip, thank you. So the next question is, with the resilience plan, how do you ensure that the helpful things like speaking to friends or making a card remain a positive experience rather than another job?
I guess you don't have to do all of them. So on my phone, so some weeks this week, I did a card. I haven't done a card for a couple of weeks. What I do is I have them on my phone to remind me, have you done this week? Have you done this? Have you done this? So I have a list on my phone. But yeah, you don't want to make it another to-do. However, it's an investment in you. So if finding a card or making a card is too hard, what about focusing on, so I have a list on my phone of all the positives that have happened that month, and I reread them. So I'm savoring. So again, I'm trying to get a double hit. I keep a list of positive things to rewire my brain, and I also reread them so I savor and I think about them. You don't want to make resilience a chore, but you know, sometimes you don't want to go to the gym. Yep, on a cold day, who wants to get dressed and go to the gym? You've got to be strong with resilience because it's something we've got to keep doing. And there are different techniques. If you didn't feel like the card, what about that metameditation? Just saying those lovely words to yourself, wishing yourself, it's called kindness and compassion. Wishing yourself kindness and compassion for all the care that you do, for all the good that you do. Take some of it for you. So mix it up, a bit like the gym. Mix it up.
Okay. That's brilliant, thank you. On the metameditation, someone's just asked for a little bit more information about what metameditation is. Just a little bit of clarity around that.
So you guys probably know as much as me. The reason I became interested in it is because I was looking at Laurie Santos does a Joy podcast. She's one of the researchers who does, she's listed at the back, and she does a really good course. So if anybody wants to do free course, it's on Coursera and it's called The Science of Wellbeing. So it's a free course. And I was listening to her this week and she talked about metameditation being evidenced as being really helpful for healthcare staff. So I went to look this up, and what it is those statements, but you say them to yourself, you focus on someone you love, you focus on something neutral, and you focus on someone you're having difficulty with. So you are saying, I guess, 4 gratitude statements or love and compassion statements to yourself, to someone you love, to someone neutral, to someone you're not in a good relationship with. They're evidencing that it is helpful in increasing optimism. Increasing optimism, we know, builds resilience. It's one of the foundation stones of resilience. So it's improving people's feelings of well-being. Again, I'm always interested in evidence-based, but it's something that she cited as something that people are trying. We need to try and practice these new things. So we don't lose anything by doing it. You could sit in the break room, you could sit in the canteen and do a loving meditation. No one knows you're going to do it. You're thinking it, but you're also probably calming your thoughts, and also you're not multitasking. How many of you do I see checking your phone during your lunch break, checking what's happening on the ward, checking results? This is about doing something for us, investing in a little bit of calm time and some loving meditation.
Okay, that's brilliant, thank you. This is an interesting one. Are there any tips for those who get tearful as soon as they feel overwhelmed?
Oh gosh, it's so hard, isn't it? That's where I think that meditation might help, because I sometimes think tears are when we're so full of feelings, you know, they just come out. And so saying those calming words to yourself and being kind and thinking, I'm doing the best I can. I'm doing the best I can in a really difficult circumstance. I'm always interested in tears because sometimes tears are about conflict. And if there's conflict, it's worth sorting out. It's very difficult to work in a situation where you're in conflict with your colleagues. Be kind to yourself, self-care, recognizing that tears sometimes are a way of releasing the pressure. So sometimes it's a pressure valve, and when the tears are out, you almost feel ready to take the world on again. So I sometimes see tears as a way of if you had a balloon that was so full it couldn't take any more, let a bit of the air out, the balloon still lasts another day. Well, tears, they're an emotional valve. They let some of the stress out and you carry on. It's also good to find out what's making me cry, and am I doing enough self-care? Am I saying enough positive things to me?
Okay, brilliant, thank you. So how do we support the ain't it bad people who are probably reaching out for support in their own way?
Yeah, really good point. So some of the ain't it bad people haven't got any insight. And some of the ain't it bad people feel a lot better after they've given you their pile of ain't it bad. So I guess you've got to sort of acknowledge, I remember having this very difficult conversation with someone who was telling me about work, and he was an ain't it bad person, and people were telling me it's difficult to work with. People dreaded working with him. And he told me, ain't it bad, ain't it awful, ain't it rotten? This is the worst hospital I've ever worked. It's absolutely awful here. It's so bad. I hate it. Stinky, rotten hospital. And I think I said to him, well, can you tell me how long have you worked here? He said, no, 30 years. So he got into a habit of ain't it bad. He wasn't aware that actually it was poisoning the atmosphere. So there's a couple of things. Is the ain't it bad person aware? Because sometimes we become used to moaning. We do. Do you need to have a tentative conversation to just tease out and find out, is there an issue behind it, or is it habit? Second thing is, ain't it bad people sometimes get picked up by positive optimism. So when we bring in, this is going well, and this is going well, and this is going well, get them on board. So if emotions are contagious, think about getting them. So with this gentleman who was telling me, ain't it bad, ain't it awful? We gave him a role, and I think it was something to do with planning an away day. Actually, when he had something to do, he was a lot better, because some of the ain't it bad, ain't it awful is people are bored, or they're stuck, or they're not self-aware. And he eventually left much happier person, but he'd had a task to do that made him feel like he was making a difference. So you will have ain't it bad people, but you can't let them pull you down the well as well, because everyone's at the bottom going, oh, it's terrible. And that makes the shift very long shift.
Absolutely, thank you. So how would you promote this way of thinking with staff in your team?
Oh, well, I did this session with a care home. I'm very sensitive to care homes at the moment because they are terribly worried that they'll have another influx and they'll have a lot of deaths, and they found it so hard last time. And they said we were moaning. And so they've set up something called Wonderful Wednesday. And on a Wednesday, when they have their team meeting, everyone has to bring 3 positive things. Everybody has to do a gratitude action. So they were being intentional about changing the culture. So one of the things that's helpful is to talk about the session with people. Talk to them and say, there's evidence that if we change our thoughts, positive psychology, our health's going to be better. I want to do everything to make me so healthy. I'm, going to build up my resilience to this pandemic. So again, it feeds into us being healthy physically. So it's really hard, but you know what? You go a lot further when you have people on the team who are on the same side as you. So talk about positive psychology. What could you do at work? I mean, Wonderful Wednesday was just one idea that this care home set up, and on it, they changed their team meeting to talk about positives, because they said they came in and they said, ain't it bad? And they said, we dread those meetings. So they've turned it around to you start the meeting on a positive and you end on gratitude. And I was saying to them, is this really going to work? Look, 5 weeks in, they're still doing it. It's made a difference. So it's a habit we've got to keep doing, got to build muscle memory. But people are saying it's changing little steps by thinking positive things and intentions and actions about.
Okay. Cathe, I think you've frozen a little bit.
What else can I help you? I'm here. I don't know if you can see me.
Yes, I can. I think it's just a little bit.
Okay, I'm saying, what can I help you?
Better. That's better. That's much better. Okay, brilliant. So people seem to be desperate to get their old life back. But now when I look back at everything that I used to fit into a week, I feel exhausted. I feel like I'm anticipating life starting back up, but not in a good way.
Yeah, that old life's gone, I'm afraid. I don't think I'll ever be able to do as much as I did. I can't multitask. My cognitions have slowed down. That old life's gone, and that's part of the grief that we're going through. They were saying that some people have really found the pandemic helpful because it's made them realize they can't do these long commutes. They can't do 5 days a week. So there is going to be a change of mindset for some people, and working from home will become more normal, or even partially. And we will have to think differently. We can't work from home on the kitchen table anymore. We need to make an intentional space and separate life, and make it, have good chairs, have good lighting. You have to invest in working from home. I think that accepting that the old life is gone is a first step. It's a first step. I don't think we will get it back. I think life will be different going forwards, because we may not want to do all the stuff we used to do. We may not want to travel 3 hours a day for work. So I think accepting that things have changed, thinking about what you liked from the old life and what you want to keep and what you don't. Interestingly, boundary-wise, now's the time to think about, is everything in my life what I want? Have I got friends that sometimes pull me down, that actually in this COVID period, I realize I don't need that. I need to be positive people who, outgoing or whatever. So again, it may be this is a time for reflection. What bits of your old life do you want? Travel might come back. That's important for me. But a lot of it won't come back. And I have no control over it. So I don't live in the future. I just live for today. That's the big change. I don't plan ahead now, a month at a time. I can't. So living in today might stop worries for tomorrow, because we don't know what tomorrow will look like.
Absolutely. That's really helpful. Thank you. So the next question is, how long have we got left? Oh, we've got about 10 minutes or so that's good. Is there a danger that reframing becomes deliberately rose-tinting a situation that might deny an opportunity to find and address a genuine problem? I would worry that trying to take positives from any situation could create a genuine improvement blind spot.
I think it's a valid statement. I don't see it that way, but I think it's a valid statement. I think what happens sometimes, though, is when something goes wrong, we get so stuck in blame, we don't see a way out of it. So, for example, sometimes people are so fearful of a complaint, they tick the box in resolving it. And I would say it's lesson identified, but not lesson learned. We often are so much in a hurry to do the right thing, to say, oh, we learn from that. We don't learn from that, because otherwise why do we have so many complaints and SIs repeated? Usually it's about communication. Usually it's about, I thought you said something and you didn't, or I thought you were doing it and you weren't. And so I don't think that necessarily it would make it rose tinted. I can see why you might think that. What I do think is, though, that we can spend so long beating ourselves up. I mean, you think about reframing. When you say something wrong, so often staff will say to me, I said this thing wrong at work, maybe it was a joke, or it was meant wrongly, or I did this, and they've spent so long analysing it. Wouldn't it have been quicker to go to the person and say, Hope, I was thinking I was a bit abrupt, or I always said something a bit stupid to you, actually, I'm really sorry. I could spend a day thinking about it, do nothing about it. Hope might not know, or Hope might be thinking, she was so rude. I think a reframe gives you an action to do, and that's what I like about it, because sometimes we stay in our own head. If you do something wrong, or you think you have, try and fix it. What a reframe does is give you an action. Otherwise, I just see a lot of people spending hours ruminating. I'll often speak to staff who'll be crying because they'll say, I think I got it wrong, I messed up, I said this, without actually going to check, well, what did that person mean? Why don't you have a conversation and just check it out? We find it very difficult to ask people about complex situations. You might have to deal with someone who's done something that you find really offensive. You know what? We'll often avoid that, spend a lot of time ruminating on it, worry about it, and then maybe think the person doesn't like me. The best thing to do would be to have an action where you actually go and talk to the person and find out what is going wrong. I did think you were maybe a bit rude to me in the way you spoke to me. Can we talk about it? Sounds easy when I'm saying it. It's something that I find people find really hard to do, because they're worried about the response. So yes, I take on board that it could appear rose-tinted glasses. However, I would say an action is probably more helpful than a thought.
Yeah, absolutely. I think lots of people can relate to that, so hopefully that's helpful. So any tips for managing anxiety if there is a last minute change to the working day, such as being asked to attend a different location at short notice?
Yeah, that's where I would see a reframe. So I've talked a lot to staff who've been redeployed and had to go and work in different areas, and the huge anxiety, and that's called anticipation anxiety. So it's not based on reality, it's based on the fear that something might happen that I can't control. So anticipation anxiety does cause us real stress, free-floating anxiety. And what I've seen some people do is actually say, I'm going to reframe this, I'm so anxious. Wait, what could happen is I learn a new skill, I meet some new people, I see it as a challenge, and the reframe gets them over the negative thought of this is going to be awful, no one's going to speak to you, don't know what to do. So reframing that situation is a really good way of thinking, well, it's a learning opportunity. Maybe I won't like it, but maybe I will. Maybe I'll meet someone new. Maybe I'll try a new skill. And I've seen teams, really interesting, 2 teams I was working with. One team was redeployed and they felt depressed. I spoke to a number of them. They said, we feel de-skilled, unappreciated, depressed because we've been redeployed. Another team said, we've been redeployed. We've seen it as a challenge. We've learned new skills. We've met other people. We will get back in our old team when this is over. But do you know what? This is an opportunity to do and see things differently in a hospital. So we're going to grab it. And the difference, if I could have put them together, between a team of depressed, experienced staff who were telling me they might leave because they saw redeployment as a downgrade, to a team of people thinking, let's do the challenge and reframe it. And the difference was huge in their mental health, huge. And I grab hold of that because I think anxiety comes from uncertainty. A reframe can really help. A reframe can really help there.
Okay, that's brilliant. Thank you. So we've got time for another couple of questions. I know we've got so many, but we'll try and get through as many as we can. So do you have any helpful tips for me? I feel like I'm always rushing around in both work and personal life. I'm busy, but often feel anxious and stressed, and I find it difficult not to do this.
Yeah, so that's me, that's describing me. So one, I've got a plan. So I find if I don't plan my self-care, so I would be rushing around, forget to have lunch, all those things that would make me stressed and late. So because I know that I think a bit slower during the pandemic, I do things differently. So I make sure I do have lunch if I have to make it the night before. I do lay out what I'm going to wear. I stop doing so much for other people. That's part of my boundary setting because I got to look after Cathe first. So some of the rushing around is an old habit from old life. Can't do that now. Got to think, what are the things I need to do and what are the things I have to do? So you might think, I've always made the dinner and I've always, cleaned up and I've always done it. You might have to drop your standards because this is a new way of being. Your life is overlaid with anxiety. The pandemic has put an anxiety over all of us. So we're operating differently now. So I'm more forgiving to myself if I don't get it right. But self-care means I plan my lunch the night before. I find out what food I'm going to have. So I'm not rushing around. When you rush around and generate anxiety, you're probably also saying to yourself, oh, you've done it again. You haven't got this right. So watch the negative self-talk and think, what can I cut down on? What can I cut back on? And what can I do to make sure that the day runs more smoothly?
Okay, brilliant tips. Thank you. So the next question is, as an optimist, how do you translate that into something useful rather than annoying for someone struggling?
Yeah, well, such a good question, because not everybody are optimists. People are different characters and creatures, and You can't force your optimism on people, because that would almost be into the shaming. So if someone feels really down, the last thing I want is someone really bouncy. What have you got to be down about? We're getting the vaccine. Nobody wants to hear that. So as well as being an optimist, I think being an active listener is the best skill you can give people. Now, active listening, you're not giving them a solution. You're not telling them your story. You're hearing their story. And if you ever really had someone listen to you, it's such a nice gift to have. Just to take that time to listen. Don't fix it. Don't give them a solution. Just that human connection and empathy is so comforting at this time. Your optimism you can keep for yourself. People don't always want to hear it, don't always need it. But giving the gift of active listening is probably the best thing you could do, so you're not annoying, you are there in presence. You're offering solutions, but being able to listen. And time is such a big gift. Having someone sit and listen and hear the thoughts of an anxious person. And sometimes when people have had this space to talk out the worries, they find their own solution.
That's brilliant. Thank you. So we have access to a rainbow room at our trust daily. Staff feel that they are too busy to go and take this time out. How can we change this attitude?
Well, it's funny, isn't it? Staff feel they're too busy. Do people feel comfortable going in? Because we make excuses when we don't want to do something. Sometimes busyness is an excuse because we don't feel comfortable doing something. Is a rainbow room what staff want? Is sometimes a walk out in the fresh air better because I get a little bit of light, I get some fresh air? I'd be interested in the reason why staff say they're too busy. They might be too busy because they haven't got into the self-care, or the room doesn't feel comfortable. It's very hard to mandate this is where you go to calm down and chill, because it's here. This is where you go to calm down and chill. It's a funny one, isn't it? I'd always be interested to find out why isn't the room used, and it might feel, maybe it feels too fake. That's where you go, and it might not be what people want. So another tip for resilience that's coming through, evidence-based, is nature. I know that's so hard, but getting outside is really good for us. So I always try and have a walk to the canteen, or if I'm out, try and walk somewhere. And it may be that the rainbow room isn't the only alternative, that people actually leaving the building if they can, or leaving for a break if they can. It's actually better for us. You get fresh air, you're moving, and you're not conscious of bells or people going to put their head in and say, can I just get you for a second? Have an uninterrupted break. That's the best thing that I can recommend to staff at the moment.
That's really, really helpful. Thank you so much, Cathe. Okay, that'd be brilliant. Thank you. There's been so many wonderful comments and sharing of experience in the chat box and in the Q&A. So I can't thank you all for taking part and taking it all on board. I hope that you are all able to implement some of Cathe's tips and improve your psychological resilience. Cathe, thank you so much for taking this time out of your day to share your knowledge and your enthusiasm. It's been brilliant. So thank you very much. And thank you all for taking the time out to attend.